It depends. The diabetes which occurs during pregnancy. The thing is that both of them, husbands also have to see what they are following. Then only they will able to motivate their wives. Because of this pandemic, traditional foods also over your blood sugar levels, you will not be gestational diabetic, but
type 2 diabetes and pre-diabetes, and so stay tuned for that. Hello.
hello, how are you?
I'm not fine. I lost my
I
video.
know.
So sad about it.
No problems. We can just have a quick wrap. The diabetes which occurs during pregnancy, not because the woman is already diabetic, but it happens during pregnancy because of your changed lifestyle, your mood swings, you're not doing some physical activity, you're not staying active, you're not eating right kind of food, you're having this emotional eating and kind of telling everyone that yeah, I've got the license to eat anything. So that's the reason that you develop this gestational diabetes. Yeah. And sometimes, because your mom used to be, a mom is diabetic, or mom had diabetes during her pregnancy. So that is also one of the thing that you can also get this, gestational diabetes. It depends. If you keep yourself healthy, if you have control over your blood sugar levels, you will not be gestational diabetic. But sometimes if, because it is always being told by the elderly people that you don't have to eat for yourself. You have a life inside. You have to eat more.
Country, in an African setting, when you're pregnant, yeah, you're being
Mhm.
asked for two people. And so
Yeah.
people take it during pregnancy, and it's too
Yeah,
much.
so that's too much, and then we have these traditional foods also. Even before delivery, they have these traditional foods, and they because in the last trimester they start giving this traditional food, and so that the baby gains weight, and but it used to happen in that era when we do not have all these outside, this junk food. That
Yeah.
at that time they used to have this whole grain, flour, or whole fiber and legumes and all those things, and we do not have this junk food all around us. And then we had to walk, even if they had to visit some doctor, and 20 years ago or 25, 30 years ago, they had to walk till that place. Yeah. And yeah, so they were like, for example, in rural area, there are primary health centers were there, are there, still they are there. But
That's
nowadays, yeah,
women
nowadays people are using,
couch and sofas, they are lazying all about. You don't
yes,
walk
yes, yes,
a car or a taxi or a cab.
yes,
So,
yes.
and traditional foods, when somebody delivers, parents or grandmothers will want to cook traditional foods, oily soupies, and all that for us. And you tend to eat those foods, and it's not so healthy.
Yeah, they no,
Like
they actually traditional food are, traditional food have this thing that, I mean, they are energy giving foods, and the mother, she gets tired after feeding the child. So those foods are good. But
yeah,
along with that, you have to walk, you have to do the, little exercise. If it is a normal delivery, then you can walk around, you can have normal food. But if it's your cesarean is there, then for 2 to 3 weeks you can be, at rest, and after that only you can start off with the normal food, like start taking this oil-rich food, or the the healthy fat-rich food. Not the bad fat, but the healthy one, which we use. Like we have this clarified butter, then we have dishes cooked in clarified butter. We call them panjiri over here. That is the wheat flour. It is being sorted in a clarified butter, and nuts are being added to it. So that's a good thing, in winters, especially in winters, they keep the mother warm. They keep you warm, and they are energy giving foods.
yes.
Hmm.
In Ghanaian setting, our typical Ghanaian foods are less in fiber, and
Hmm,
so
hmm,
our
hmm,
all pregnant women to add
hmm,
more fiber to their meals, like eating
hmm,
brown rice, like eating wholemeal grains and
hmm, hmm,
cereal. like adding vegetables to their meals, and
Mm-hmm.
also nuts and some seeds. Before you get
Mm-hmm.
pregnant, start a healthy lifestyle. Plan your pregnancy so that you do not develop gestational diabetes or diabetes in pregnancy. It poses a
Mm-hmm.
lot of risks to the baby because you are likely to have a big baby and you have to
Big
go
baby,
through.
yes.
And
Seasick,
studies have
yes.
shown that mothers who get diabetes during pregnancy have a higher risk of having type 2 diabetes uh,
Yes.
later in life. And so you have to be, it is not a joke at all. It is not a joke. And sometimes, most of the times, the sugars resolve after delivery. But then some people, they are still having the same lifestyle. And so the sugars are not able to resolve, so they keep having blood sugars whilst are breastfeeding. And also some people think that you are free as a mother, so when you deliver it goes away. Mind you, it doesn't go away. Even the next pregnancy, your chances of having diabetes in pregnancy is higher. So you
Yes.
have to prepare for it. After delivery, you have to eat healthy to be able to have the next pregnancy. You will be able to have a healthy pregnancy and not have the gestational diabetes again.
Again, yes,
That
yes,
can
very true.
happen. You can have a preterm baby. You can have miscarriages when you have
Even
bleeding.
stillbirth.
Very
Even
very
you can have stillbirth.
that you check your diet. You eat a lot of fiber, and you try to avoid refined or processed foods. Eat close to nature, eat real foods, not polished and refined foods, not greasy and fried foods. People will say that I'm eating this because I feel like eating this kind of food. So
I
you
feel
every
good. You know, they
people
eat emotionally. They feel good about it.
emotional eating here. This is not about emotional eating anymore. It's not luxury to be pregnant and be lying in the sofa and couch and not doing anything and eating greasy foods and all that. The luxury is that walking, eating healthy, eating fiber, eating nuts and seeds, so that your baby will be healthy and you also will be healthy. Yeah,
Yeah,
yeah. So
absolutely correct. Absolutely
let's talk
correct.
about the fact that even now, children are developing diabetes. That is the type 1. And so we encourage all parents to and check on their children's diet. Check on their children's diet. If you are a parent, you have to make sure that the child is eating healthy and not any unhealthy food. A lot of fiber in their diet, a lot of activity. We have to reduce the screen times. And if you are a GDM mother, and then you give birth to a baby who is big, you have to watch out for that child because she is also,
Yes,
or he is also likely to develop diabetes later.
develop. Yes, yeah,
And
Jeff.
so monitor her food, her
If
diet,
not
and make
later,
sure the
yeah.
baby loses weight. The child
If not
loses.
later, yeah. If not later, then earlier. Earlier also the babies, because I've seen these days babies are quite healthy. They're overweight as per their age. They're quite overweight, and you know they tend to develop this early diabetes.
Yes, yes,
And young people also, they have this because of the lot of stress at their workplace, or their lifestyle is totally disturbed because of this pandemic also, and a lot of screen time. You know, they're spending more time on screen, and sleep time is less, and their stress is doubled, and that is also one of the reason. And then they're not moving around because the pandemic was there. There was no movement was there, like they were confined to their houses, especially people living in the big cities, those who have these houses on the, you know, in the 52-story building or the tall buildings they are living. They don't have a place to go around,
they're not
especially
supposed to.
the people in the metro cities. So, and those who are working in the multinational companies, they have to stay awake, they have these deadlines are there, you know, to so that they can achieve their targets. So these kind of people also, they have developed, you know, they're pre-diabetic these days. They are either they are pre-diabetic, or they have developed this type 2 diabetes. Yeah.
Yes, today is
So
World Diabetes Day, and we are talking about gestational diabetes, diabetes that occur in pregnancy. And I
mhm.
would like to encourage everyone to test. If you are a woman and you are yet to deliver, or you are now getting pregnant or something, if you're a young lady, you have to check your sugars. You have to check whether you're pre-diabetic, because some people are already pre-diabetic. They don't know about it, and then they just go in for pregnancy and they encounter these kind of difficulties with
Yeah,
diabetes in
I would
pregnancy.
I would like to
We are
discuss
talking
one
about
case.
gestational
Yeah,
diabetes and diabetes that happens in pregnancy, and a healthy diet and lifestyle is going to help you to avoid that or manage it well, so that you can have a healthy baby and a healthy mother.
yeah,
I have
yeah. So
in here Dr. Shipra from India. She is so knowledgeable and she's a sweet friend. She is delving and discussing with us into gestational diabetes. Our first video, we lost it because I went off technical challenges. We are back again and we are still discussing. You can send in your questions and then we'll be
yeah,
dropping it soon. Yeah, we'll be
yeah.
dropping
So
it.
I have another case to discuss. That there was a lady who was pregnant and she was diagnosed with gestational diabetes, and her husband was also pre-diabetic. So
Okay.
both of them had come, and then I spoke to them, and I came to know that their lifestyle is like that, very because the both of them are working in a multinational, and they do not have time for the physical activity, and whatever the maid cooks at home, they eat, or at times the maid is not there. They have to order from the eateries outside, and also the lady didn't know how to cook. She was not that good at cooking. So that was also the
Fine.
reason
That
that
let me marry a lady who knows how to cook. Okay.
yeah,
And
so she didn't know how to, because
that's that's not
and the
healthy.
lifestyle. Yes, yes, and the lifestyle they follow was very lazy. Yeah.
When you marry a man who is diabetic or a pre-diabetic husband, is it likely to have a GDM because it's your
Yes, of
husband?
no, no, the husband, it's no, no, I'm saying not because she's married to him and she's getting the GDM, not because of the husband. The thing is that both of them, husbands also have to see what they are following. Then only they will able to motivate their wives. Because yes,
Okay.
wife is
Yes. So
eating
that's
emotionally, but
that's
husband
what
has
we're
to
going to
be a
go on to,
support.
so that we know what
if if
we are
yeah, if husband also, if
also
husband also becomes a
also what
pre-diabetic, or he's also at the verge of getting diabetes, then naturally the wife, and she is pregnant also, so there will be a lot of complications beyond. Both of them will face the same, the complications. So if the I mean both of them have to watch. If they're planning a pregnancy, they should, both of them should watch their weight, weight. So when they go and visit a dietitian, I mean, it's always good to visit a dietitian with your spouse, so that both can be consulted simultaneously, and they will actually, because if the pregnant women, she is diabetic, so husband is there to support her, to motivate her. If husband is also like that, only eating the way she is eating, then they'll be in trouble. Future, both of them will be in trouble.
yes, yes, it's true.
Yes, so that is, these are the things actually. I'm discussing what I have seen in my practice for for the past 15 years, and different set of people come. Sometimes the lady is all alone at home, nobody is there to take care of her. Sometimes the mothers, those who are taking care, they are stuffing them with a lot of traditional food, and their portion size is high. I mean, they eat large amount of food. Yeah, portion size is large, and they don't keep a check on what they're eating, and then they don't keep them, even if they keep themselves hydrated, they do not do some physical activity. They don't do not walk around in the house, or so and then they also avoid fiber during that stage, because they think that it causes flatulence, but flatulence
Exactly.
can still happen if you do not chew your food properly.
Hopefully.
Yeah,
Yeah.
yeah,
So
yeah,
what I'm saying is that sometimes during pregnancy, we are being taken care of by our mothers, and they give us a lot of this
yeah,
traditional food and high
yes,
portions. They'll tell you that they are
yes.
eating for two, so we eat a lot, and that is what is also not helping us. Also, the people get stressed. In this world and era, a lot of women are working in the corporate offices, and you get pregnant and you're still working, and you're under stress, and they are likely
You're
to
under
develop
stress,
them
lack of sleep is there.
lack of sleep and
Yeah,
stress. So
stress.
affect. the blood sugars of the pregnant woman. Yeah, that's
Yes,
great.
yes.
So, I mean, we have had a fruitful conversation from the onset, and we lost it, but those who joined had a lot to learn. We'll
I
still
think I can
continue.
see few more new joinees from India as well.
Yes, we do.
Welcome, welcome.
Namaste. Welcome, welcome,
Yeah. So I was
welcome.
telling you in my last conversation that this type 2 diabetes, people can manage to reverse it. The pre-diabetic people and the people who are having type 2 diabetes, they can reverse it by following a healthy lifestyle. And I was giving example of my father who was lately diagnosed with, in his later age of life, he was diagnosed with type 2 diabetes. So his HbA1c was somewhere around 7.5 or 7.7. But following a healthy lifestyle and doing yoga and pranayam here, he has managed to pull his this HbA1c to 5.5, and
That's
his sugar levels are absolutely normal. So that's a live example in my home, and I want to share with people that type 2 diabetes and pre-diabetic people, they can manage to reverse it by following a healthy lifestyle. But the one who are like children, or the one who are suffering from type 1 diabetes, they have to manage it through proper diet, physical activity, and staying active, and following this good lifestyle, and sleep on time. So, but with type 1 diabetes, because we cannot do anything, because the body is not able to produce insulin. So you have to take outside support and for their survival. Yeah? It is insulin dependent. And in case of gestational diabetes, the mothers should plan their pregnancy. Prior to planning their pregnancy, they should watch their weight, they should meet a clinical dietitian, they should see their gynecologist, and then only they should plan their, and because the gynecologist will suggest her to change her lifestyle if she's overweight. And even if she's not overweight, still she should be doing some physical activity to stay fit, so that it will help her correct her posture during pregnancy, and like backaches and fatigue won't be there. So staying active is really important pre-pregnancy, during pregnancy, and post-pregnancy. So this is how, I mean, and that's what we were discussing earlier, and that's a quick wrap up of what we have discussed.
yeah. So, to my viewers, if you heard my guest well, those who are coming to get married, those who are newly married, come and see the night your husband,
Yes.
so that we help you plan a healthy lifestyle to avoid pregnancy complications, and even it
Yeah.
enhances fertility. I think that every wedding planner should have a dietitian as part of the team, so that we can
Yes,
help you
absolutely.
to do this very, very quickly. So,
Yes, yes.
Shipra, I would thank you so much for
Oh,
joining.
your baby's
My
crying.
baby is crying. I've
She's
spent
calling you.
I use about 2 hours. So thank you
Yeah.
so much for joining. Thank you to everyone who joined with the first session and
And thank you
everything.
so much for having me here. I
Yes, so
love to talk to
if you have
you.
questions, you can contact at the Nutrition, my guest from India, and you can contact me to finance dietitian with all your questions. If you want us to help you, manage you, and help you have a
Yeah.
healthy lifestyle, we are available. You can slide in our DMs, and then we'll take charge of you and your family. Thank you so
Yes.
much. Enjoy the rest of the weekend. And next week, we'll be coming your way with another episode. And so stay tuned. Don't go anywhere. And it's bye for now. Shipra, thank
Yeah.
you so much.
Bye. Namaste. Namaste from India. Take care.
The risk factors, and we talked about the fact that when somebody is obese or overweight before pregnancy and also gains weight, somebody gains more weight than they should during pregnancy, they are likely to have gestational diabetes or pregnancy in diabetes.